Hello friend, welcome to the channel Pharmacy Dictionary. We are studying about the route of drug excretion, and under that we have studied the renal route of drug excretion. In today's video, we are going to study about the other route of drug excretion apart from or other than the renal one. What are these important route of drug excretion? These are the drug may eliminate either feces or through exhaled air or through bile or through saliva or sweating, or somehow they are excreted with the help of milk and sperm. What are the consequences? What are the basic criteria, or we can say what are the basic parameter for any drug to be eliminated via any of this route of drug elimination? So this is not as important as the renal one, but these are also included under excretion, so we should study about them. The first one is feces. Whenever we take any drug, according to their lipid solubility or water solubility, depending upon their plasma protein binding or non-plasma protein binding, their elimination path is decided. So in case of feces, the drug which are most of the derived from the bile are get excreted from the feces. That means a drug which get conjugated with the bile get eliminated with the help of feces or stool. So the criteria for being excreted from feces are the drug should have larger molecules. The molecular weight should be more than 300. Then they will get excreted with the help of bile or feces. And the previous one have studied about the renal route of elimination. So these are excreted with the help of bile. Now drugs in bile, which are the list of drugs which get eliminated from the bile. These are very important because this whiteboard section is not very important for your seasonal exam point of view except your main competition point of view. So you should remember the example of drug which get eliminated via bile. These are erythromycin, example of antibiotics, ampicillin, tetracycline, rifampin, and different types of oral contraceptive pills or oral contraceptive drugs. These are get eliminated in bile. So the important thing is that we should remember the drug which get excreted with a specific pathway, and under the feces drug excreted in bile, and we can have a note. The note says certain drugs are directly excreted into colon. To get excreted with the help of bile, the drug should dissolve in the bile, and then they will go to the small intestine, then large intestine, so that they get evacuated with the feces and stool. Somehow certain drugs are there which directly secreted or directly excreted with the help of colon. These drugs are heavy metals. Basically these are not included under drug, but we have studied that this could be included inside the drug value. So these are pesticide actually we can say, and different types of unwanted chemicals. So heavy metals and different types of anthracene purgative are get eliminated with the help of colon, that means large intestine. Purgative, that means any drug which increase the evacuation of bowel movement is called purgative, or in case of increase the formation of bowel so that the constipation can be relieved. Next one is exhaled air. The different route of drug elimination depends upon their solubility parameter. In case of exhalation through air, the drug should either in form of gases or that should be a volatile liquid. Then only they get eliminated from the exhaled air. Example are general anesthetic like alcohol, like chloroform and alcohol. Let me clear you the example with alcohol. Have you ever came into contact with the person who have taken alcohol? Then you can feel without talking, without knowing the fact, then after talking to him or her, the smell came from her mouth, his mouth, inform you regarding he or she has drinking alcohol. So that get excreted with the help of exhaled air. Whenever they exhale the air, they will come out with their breath because of these alcohol are volatile in nature. So irrespective of their lipid solubility, in case of alcohol we are talking about, irrespective of their lipid solubility, their elimination by lungs depends upon their partial pressure. So we can say this important parameter, the alveolar transfer of the particular drug, it may be a general anesthetic or it may be alcohol, that depend upon the partial pressure in its blood. That means what is the pressure of that particular gas in the lungs, in the ways available in the alveoli, that depend their exhalation rate. So coming to the next route of drug excretion, this is saliva and sweat. Although these are very minor pathway, very less amount of drug and very specific drug get eliminated with the saliva and sweat. So this is written as a minor importance for the drug excretion point of view. But there are few example of drug which get eliminated via this route of drug administration. These are lithium, used as an antipsychotic agent, potassium iodide, rifampin, which is example of anti-tubercular drug, and different types of heavy metals. They may get excreted from saliva and sweat. So there is an important thing. In case of saliva, the saliva gets secreted, but many of us get swallowed that saliva once again. So that is not a proper excretion of the particular drug. But sweat can be useful in case of elimination of drug. The sweating can also include this alcohol also. So coming to the next route of drug elimination, that is milk. That means lactating woman can eliminate its drug, eliminate drug from her body, and that drug which is being eliminated with the help of milk can introduce into the fetus who is depending upon the mother's milk. Lactating woman can transfer the drug into his fetus, so that the fetus may receive this kind of drug. The mother is not in a risk side, but the fetus is on higher risk because the nature of drug may affect the normal physiological function in the fetus. So this is very important point of view. So that is very important. The mother should not receive any of those drugs which can get excreted with the help of milk. This is a important parameter while in case of lactation. This is not significant for mother but significant for infant who is receiving milk from the mother. There are following parameter regarding this elimination route. This say drugs enter into the breast by passive diffusion. Movement of drug from this blood towards the breast side depends upon the passive diffusion. So because there is concentration gradient across there. Next one is more lipid and less protein bound drug goes through this part so that they may get diffused better in quantity. What is the parameter? More lipid soluble. That means if the drug is higher lipid soluble drug, then it is having higher chances to be excreted with the help of milk. And along with that, less protein binding, because we have already studied the parameter of protein binding. If the drug molecule get bounded with the protein molecule, they will behave like a macromolecule, and these macromolecule are not able to cross different types of barrier. So if the drug is to be eliminated with the help of milk from the lactating woman, then the drug should have less protein bound so that they may get secreted via or diffused via this kind of route of drug elimination. The next one is an important parameter, we can say case study type of question. The pH of milk is 7, that is lower than the plasma pH. So there are chances for basic drug which may get concentrated in the milk, and that concentrated drug which is present in the milk may transfer to the sucking fetus so that the drug may pass through the fetus. So these were very simple, not very important, but few routes are important for their respective route of elimination for your comprehension point of view. So that's all for the day. This was very short video regarding the remaining part of route of drug excretion. Thank you very much for watching this video, and the reference for today's topic is KD Tripathi latest, that means 8th edition. If you want to take a screenshot of this lecture whiteboard, then you may have after some time. Thank you. Please do take care of yourself.